Good morning to all of you, to Gisela, to our sign language interpreter, and to all of those who tune in every morning. Excuse me while I remove my face mask. Today is a bad day. 686 people are hospitalized in Cuba. 23 are under observation. There are 353 suspected cases and 310 confirmed active cases. In our primary healthcare system, 11,351 people continue to be monitored by our professionals and specialists. Yesterday, the highest number of samples were processed thus far, a number that should increase over coming days. 3,941 samples were processed in our various molecular biology laboratories. 1,719 were processed at the Pedro Curi Tropical Medicine Institute, 579 in Havana's Hygiene, Epidemiology and Microbiology Center, 405 in Villa Claras, 282 in Santiago de Cuba, 503 in the Genetic Engineering and Biotechnology Center Lab, 322 in the Hermanos Amajeires Hospital Laboratory, and 331 in the Civil Defense Laboratories. Of the samples processed, 54 tested positive for SARS-CoV-2 and COVID-19. This is the highest number we've seen in recent months. This brings the total number of samples processed in the entire country since the pandemic began to 289,412, of which 2,829, or 0.98%, have tested positive for the virus. Yesterday, given the epidemiological situation in certain territories, samples were tested from all of the country's provinces. 115 from Pinar del Rio, 435 from Artemisa, 2,612 from Havana, 77 from Mayabeque, 180 from Villa Clara, 116 from Santiago de Cuba, 65 from Granma, 66 from Camagüey, and so on and so forth from all of the country's provinces. Of the 54 positive cases diagnosed yesterday, 52 are Cubans and 2 are foreigners. 47 positive cases yesterday are confirmed case contacts. This brings the total number of confirmed case contacts to 2,408 people, or 86.5% of all diagnosed cases. I stress this point so that anyone who knows that they have had contact with a person who is tested positive for the virus or has been isolated pending testing, immediately contact health authorities in order to identify as many contacts as possible. 4 people who tested positive for the virus yesterday contracted it abroad, as well as the 2 foreigners I previously mentioned. And of the 54 cases diagnosed yesterday, the source of infection linked to 1 case is yet to be determined. This brings the total number of cases where it has not been possible to determine the source of infection in Cuba to 137. 27 people diagnosed yesterday are male for 50.3% of all cases. 27 are also female, representing 49.7% of all diagnosed cases. 40 of the 54, or 74%, were asymptomatic at the time of testing. These cases account for 56.1% of all positive cases on the island. When we look at this figure over the last 15 days, it rises to 61.6%. By age group, of the 54 positive cases yesterday, 6 are under the age of 20, for a total of 323 children and young people under 20 to have tested positive for the virus in Cuba, of which 287 have responded positively to treatment and been discharged from hospital, representing 88.8% of all cases in this age group. 28 are between 20 and 39 years of age, 15 are between 40 and 59, and 5 are over the age of 60. The 54 positive cases belong to Havana, with 43, Villa Clara with 6, Artemisa with 4, and Matanzas with 1 case. As I mentioned at the beginning of the briefing, 6 of the 54 positive cases are imported. 5 of these cases belong to Havana, and 1 to Matanzas. 2 of the 6 imported cases are foreigners. By municipality, the 4 cases from Artemisa diagnosed yesterday are from Mariel and Bauta, above all Mariel. In Villa Clara, Camagüey has 5 cases and Santa Clara has 1. In Matanzas, the imported case is from Jaguay Grande, and the 47 cases from Havana belong to the municipalities of Habana del Este, Marianao, Boyeros, Plaza, 10 de Octubre, La Lisa, Guanabacoa, Habana Vieja, Centro Habana, and Playa. This shows us just how widely spread the virus is in Havana. Yesterday's results mean, therefore, an increase in the confirmed case rate per 100,000 inhabitants over the last 15 days. Artemisa continues to have the highest rate, standing at 22.14, higher than yesterday's. Havana's rate also rises, now standing at 7.87 per 100,000 inhabitants. Villa Clara's also rises and currently stands at 1.16 per 100,000 inhabitants. This means that Cuba's rate also increases to 2.73 per 100,000 inhabitants over the last 15 days, higher than yesterday's figure. Of the 2,829 people who have been diagnosed with the virus thus far in Cuba, 310, or 10.9%, are active hospitalized cases, the most we've had over the last 2 or 3 months. 304, or 98.1%, are clinically stable. No deaths were reported in Cuba yesterday. Since the pandemic began, the island has registered a total of 88 deaths, for a mortality rate of 3.31%, which, compared with the regional rate, places Cuba in 21st position in the Americas and 113th in the world. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, 20 people were discharged from hospital. A while back, this might have been a positive result, but compared with the 54 confirmed cases yesterday, it's a relatively small number. 1 person was discharged from hospital in Pinar del Rio, 13 from Artemisa, and 6 from Havana. This means that, to date, 85.9% of all confirmed cases in Cuba have recovered from the virus and are now back at home, living their normal lives and undertaking their usual activities. However, the number of patients reported as serious has risen to 6. At first, there were 2, then 4, and yesterday another 2. So, as we can see, as the number of cases rises, the risk also increases. This is the situation in Cuba, which, as you can see, is very complex. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. The total number of COVID-19 cases worldwide currently stands at 18,793,522, after 273,943 people were diagnosed with the virus yesterday. And it looks likely that tomorrow, if not the day after, we will reach 19 million confirmed cases. Yesterday, a high number of people died of the virus. We're talking about 7,176, for a total of 707,715 COVID-19 related fatalities and a mortality rate of 3.76%. The region of the Americas, which those of you who have been following will know, represents more and more of the overall number of cases worldwide, currently accounting for 54.04% of all COVID-19 cases around the world, after 153,013 new cases were reported yesterday, for a total of 10,156,238 confirmed cases. Notice how, of the 18 million cases worldwide, over 10 million, or 54.04%, are from the Americas, meaning that, just as we have seen over recent weeks, the region continues to be the epicenter of the pandemic. A high number of deaths were also reported. Of the 7,176 COVID-19 fatalities worldwide yesterday, 4,702 occurred in the region, bringing the COVID-19 death toll in the Americas to 377,090 and a mortality rate of 3.71. Just like yesterday, the United States and Brazil continue to top the list of countries with the highest number of cases. The US currently has over 4,823,000 cases, and more importantly, 153,256 COVID-19 fatalities. Yesterday, 1,450 people died of the virus in the United States. Next is Brazil, with 2,859,073 cases, and 1,437 deaths reported yesterday, for a total of 97,256 fatalities. This is the information we have on the behavior of the pandemic in Cuba and the world.